here in South Louisiana. Anyone who's got allergies, take this.
NAD is probably the biggest thing coming out right now on anti-aging. Normally, like when we're tight in here and you start getting that pressure and you're taking those joints and muscles through full range, this one feels almost addicting. So consistency over intensity. And then we're just going to roll up and down. It seems crazy, but when you go get massages and they're finding tightness in here, the first thing you need to do is start releasing this stuff. Kelly, thank you. You did the exercises last week and it helped a lot.
Good evening, my friends. Happy Wednesday. I hope everybody is doing great. Please drop me a comment, say hi, give me a thumbs up if you can hear me, making sure that everybody can hear. Welcome to Tea with Dr. D. Today was a mate afternoon. I was drinking yerba mate and I left my mate gourd before I jumped on with y'all. So I'm without tea this evening. I was drinking tea this afternoon, I promise. And most of my patients will vouch for me that they see it all the time. So how are y'all doing? I hope everybody's doing great. I'm gonna give y'all my full disclosure. I just looked at this. So I was eating steak yesterday or day before yesterday. I took a bite and I chipped my tooth. And so I went to a wonderful dentist, Dr. Christy Barra, and she did an awesome job. So if you see me like smiling and checking my teeth out, I'm just seeing how it looks. But we did get it fixed up and everything looks great. And I can eat again. So that's always good. So welcome to Tea with Dr. D. If you've never been here, I'm Dr. Derek Hines. I own and founded Acadiana Pain and Performance, where we bring in all the best research and technology to help people heal faster and improve their health so that they can live the life they want. I do this once a month so that I can answer questions and get back out to y'all and kind of give us kind of a little bit of an open time to ask any questions. And we try to get a few ahead of time. So if you have questions, you can send us a text message at any point that goes straight to me, 801-691-7582, if you're listening to this later. But I do get those. Thank y'all for the text messages. If that's getting responses, that's from me. I'm answering those questions. So I know we've gotten a lot of questions that we'll try and go through, but I would love to answer your questions while we're on here. So if anything has been on your mind about health or healing or regenerative therapy or supplements, definitely let me know and I'll answer as best as I can. So that's what Tea with Dr. D is for, me to answer questions and tell you what I think about stuff. Take that for what it is. But let's dive into some questions, Al. I know we had gotten this, we had done probably a few posts this week on laser therapy and high intensity laser therapy specifically. So there's a big difference. My first thing is there's a big difference between low level kind of red light therapy and high intensity laser therapy. These, while they're both putting a red light into your body, they're doing very different things. So if you have like a red light panel or something like that at home that you're using to help improve superficial healing or wound care, awesome. It does a really good job. I would not put that in the same category as like high intensity laser therapy. High intensity laser therapy is something done above 40 watts, and very often the wavelength of these is different. Ours is 1,080. So like it goes much deeper into the body. So to give you an example, like a typical home red light panel might penetrate, if we're lucky, let's say a 1/4 inch, 1/2 inch deep into the body. A high intensity laser will go about 5 inches into the body. And what does that do? So that like charges all those cells to produce more energy. If we have cells in that area that are trying to clear out inflammation, laser helps those cells have much more energy to do that. So up to like 8 times more energy. So if we have an inflamed area, and we've seen this in one single session, where like somebody comes in, the ankle's all swollen, they sprain their ankle. We do a full laser session on it. And immediately, without even touching the ankle, you'll see swelling in that area go down 50%. This is acute. So those cells are already active. We're just giving them all this extra energy. So there's been many studies, and I can drop some links into the comments. If y'all have further questions on this, let me know. But there's been quite a few studies on the inflammatory effects in frozen shoulder. There's been quite a few on carpal tunnel, on high intensity laser and what it does in carpal tunnel. There's been quite a few in knee osteoarthritis, among others. Those are the ones that I know we've got really good studies on. And it shows that if we're doing high intensity laser, you're reducing inflammation, you're reducing pain, you're increasing repair. And so all of that means like we're going to heal faster and we're going to need less pain medication. We're going to have less pain during that, whether that is frozen shoulder or knee arthritis. We've seen this in many different types of cases. We stack laser therapy because of the energy that it's giving your body. If you stack this with what we call targeted laser, so we'll come behind laser and we'll do some medical needling to start a healing process. So those cells are turned on, you come and laser them, you give them all this energy. Now they're just going to like go crazy and really try and go through the repair process. A lot of times in our regenerative therapy cases, we are also adding in peptide therapy and using different stacks of peptides to stimulate repair and regeneration. That does take a lot of energy. And so when you're on a peptide, you want to be telling the body where to send the peptide, getting some form of like treatment to that area. I love the idea of taking a peptide and having needle therapy of some sort done on the painful area, especially in chronic pain situations, because that starts a new healing process in that area. So to me, it makes a lot of sense that if you've had chronic pain, don't just take a peptide. You need to take a peptide and get like treatment with that so that your body knows what to do with it. And then we come behind and add laser therapy to it. So it does a great job of improving inflammatory cell markers in that area and helping the cells clear out inflammation. So probably a long-winded answer, but that's what high intensity laser therapy can do to improve inflammation. And a nice thing to mention is it's not blocking it. It's not doing anything like that. It's helping your body process it. So it's not inhibiting the healing process there. So hopefully that answers that question. But let me know if you need any follow-up or deeper information on that. I'm going to call you Zoo 5 Tennis. By the way, anybody who's listening to this or watching this, if you're playing in the Crawfish Classic, stay tuned. We have some really fun stuff that we're doing for all of our tennis athletes that are going to be participating in the Crawfish Classic so that we can get y'all through that wonderful tennis weekend without any pain. What are the best exercises for shoulder pain and stiffness? Great question. I'll tell you my favorites for shoulder pain. One of my favorites that I would say, like, if you have any shoulder pain or stiffness, is hanging. If you can get like a pull-up bar and do a palm forward hang where you're just like supporting your shoulder and decompressing the shoulder. We think of that like, you know, you get spinal decompression if your back is stiff and we've lost joint space. We want to do the same thing for our shoulders. We're all forward and tight, and a lot of these tissues across the front of the shoulder tighten. What I want all of my patients to do is have great compression-free and impingement-free shoulder range of motion. One of the best things you can do for that is just start decompressing the shoulder. So I like to have people do that for 30 seconds. Repeat that about 5 to 10 times, depending on how much stiffness or pain you're having. If you're having a lot of shoulder pain, especially with movement, this is a really great impingement test. Reach your arm across your body. So take your right arm if you're listening and not watching this. Grab your left shoulder and then try to raise your elbow up all the way to your forehead. If you can't do that, or you feel some pulling back behind the shoulder or on top, you're impinging that shoulder some. Grabbing like a pull-up bar and almost like taking your weight off. So that one shoulder is just hanging and stretching out. You'll stretch much deeper tissues. You'll stretch that capsule out, and you'll really take that shoulder out of compression, so that we have full range of motion. So that's probably my favorite for shoulder pain and stiffness. Accumulate 5 minutes of shoulder decompression a day in the beginning for the first, let's say, 5 to 10 days. And at that point, if you're getting full range of motion and you're not having pain, then we can back down. Another of my favorites for shoulder pain is something called CARS. So if you'll look up shoulder CARS while you're listening to this, it's going to give you this like kind of concentric, controlled angular rotations, if you will. And what that does is basically starts to retrain my body where my joint is supposed to be. So the way I explain this to patients is like, if I sit and in a regular day, I go from here to forward and back to here, my body thinks that that's my full shoulder range of motion. And so it's going to kind of tighten around those parameters. What shoulder CARS are, and what CARS in any part of the body are, is where it's retraining your body what my end ranges of motion are. So a way that you can think about CARS, if I'm just doing like my shoulders here, is I want them to go all the way forward and down. So I'm going to that forward lower corner, and I'm going to hold that. And then I'm going to go all the way forward and up to that corner. And then I'm going to stay up and go back to that corner, and then stay back and go down to the lower back corner. And then I'll reverse that and do that whole thing again. So you're going to the all the way in ranges of motion that you can, all the way down and forward, forward and up and back and down. And we're trying to retrain the body. The first time you do this, very common that you'll like cramp up and have your shoulders almost want to go into like spasms. That's because you have not contracted those muscle fibers to that degree in quite a while, and your body doesn't know what to do with it. So we can retrain that. It gets better really fast, and you'll go through a full shoulder CAR exercise and think you're going to be very sore the next day. And you're going to notice like you wake up and you're like, I feel great. I'm not having soreness, and I can actually move through these ranges very well. So look up shoulder CARS. I think that's a great place to start. If you can start doing like hanging every day, do shoulder decompression every day, and you start doing some shoulder CARS, those are going to get you out of that pain and stiffness really quickly. Then we want to probably come back later and start looking at balancing shoulder motion. But that would be my starting point. Just do those two things. Start to do shoulder decompression, look up shoulder CARS. Let's keep it kind of straight and simple. And that, by the way, that will help your tennis game quite a bit, among other things. But hope that helps. I feel like we get this question a lot, so bear with me. How often should I do cryotherapy for inflammation? It's a great question. I know research continues to come out on cryotherapy and how often should we do it. I've used, y'all probably heard me talk about this. Suzanne Soderberg's research was probably the biggest study done on how often cryotherapy should be done to get the best results. What they found was if we're doing it for symptomatic improvement, you should accumulate 11 minutes of cold exposure in at least 2 to 3 different sessions. So don't do 11 minutes all at one time throughout a week. So that study showed quite clearly, like when you get to 11 minutes, you really start to change inflammation, stem cell expression, brown adipose tissue activation. So that's where we want to target if somebody is systemically inflamed. And so in those situations, we would say do 3 sessions a week while you're inflamed. And then as you get to the point where we're no longer dealing with systemic inflammation, whether you just feel really good or you find that out on a blood test, I would say do both. Then you can start to try and find what is your perfect little kind of maintenance schedule. I'll tell you, I know absolutely, even if I get to where I'm just doing 1 a week, I still feel really good if I'm doing all the other things right. So if I'm eating well, I'm taking the right kind of supplements, I'm sleeping well, I think I can get by on a maintenance schedule of me doing like 1 a week. When I get below that, I start to notice like, immune system's not where it should. My body doesn't quite feel like it's functioning as well. I'm probably not sleeping quite as well. So I try not to dip below the 1 a week, but if we're doing it for inflammation, the best research we currently have is that you should try to accumulate 11 minutes in a week through multiple sessions. Hopefully that helps. You can do that in multiple mediums. But yeah. Thank you for the question. I don't want to butcher your name, so we'll say Agua. But so can we explain the other McGill Big 3 exercises? I know we had some questions about this last month. So the McGill Big 3 are a set of exercise that Stu McGill, one of the biggest like back pain researchers in the world, has kind of identified as some of the best exercises that you can do to create stability in your low back and to prevent injury. And that's a really nice thing, is like, can I have a more stable and resilient spine? And that's what the Big 3 are. So the Big 3 exercises are a bird dog exercise where you're doing an alternate arm and leg. If you've ever seen that, it's like, you know, you're on your hands and knees and you're doing your opposite arm, your right arm up, and you lift your left leg up. And you're really trying to stabilize the core with that. The other one is a side plank. So you're on your side and you're just doing a side plank. And then a modified kind of like they call it a curl up. It's basically a modified ab crunch. These work really well. What we tell our patients to start with, if you're doing those, you're going to hold that bird dog one for 3 seconds, and we're trying to do 3 sets of 10. You're going to try and hold your side plank in the beginning for 30 seconds on each side, and you're trying to do that 3 rounds also. And then your little modified ab crunch, you're going to hold at the top for 3 seconds, and we're trying to do that one 3 sets of 10 as well. So those 3 done every day have been a absolute game changer for so many of my patients who've had core strength issues leading to low back pain. But whenever you study this, there was a really good study done in 2018, I believe, on these. And it showed that people who completed them and did these Big 3 exercises had less back pain, had better function of the back, had better back motion. I think they tested flexion and extension, if I remember correctly. And all these metrics improved if people were completing the McGill Big 3. So it's a really nice set of exercises. I've almost never had somebody who said, oh, these are making my back worse. I'm getting sore from it. For the most part, you feel really good doing these things every day. And you can kind of control the motion. And I think that's the superpower of this. It's very accessible. You're creating tension around your spine, but you're doing it in a very safe way. So you're not going to injure yourself doing more of it or anything like that. So bird dog, side plank, curl up, or ab crunch. And you can look those up, and they've got some great videos on it. It's a really wonderful kind of suite of exercises that helps a lot in terms of getting your back more resilient, getting your back stronger. It's such a good little kind of group of exercises. So awesome. Let me know if you have any further questions. If you do these, I would give them a little bit of time. Give this probably 6 weeks before you really kind of, make a decision. Absolutely. If you are having pain, despite doing this, you probably haven't got your like pain generating tissue. We tell all of our patients, like, the stability and the strength of the healing process come at like stage 4. So you got to get pain down. You got to get rid of inflammation. We have to restore joint and muscle range of motion. And then we're getting to muscle coordination and strength. You can't skip steps. So if you're having active pain, start very easy with these and accumulate it, but you'll want to get further treatment and assessment if you do a month to 6 weeks of these and you're not seeing any change in your pain. It doesn't mean that these are wrong for you. It could be the right thing, that you just need a little bit of help to get your tissues to that level. So disclaimer, if you do these for a little while and you're like, oh, it's still here, doesn't mean they're bad. You might just need a little bit of extra attention to figure out what's going on in there. So I hope that helps with any back pain problems. I love these. I love the big three. Any of my back pain patients who've seen this or listening to this know that we pass these out a lot. So I agree, Heather. I love the Bird Dog. Creates a bunch of like rotational tension, and if you really try and keep your core tight, it does a great job of strengthening. You'll work up. You do those 3, and you do 3 rounds of all those, like we're talking about. You're gonna finish, and you're like, I did some work. I did some good work. Creatine. Creatine. I've talked about creatine a lot. I love creatine is my first answer. I think of all the supplements that we take for physical health, creatine is such a low bar that we should almost all take it. I can't think of very many people who should not and would not benefit from taking creatine. There's so much research that has been done on creatine. It's probably the most researched performance supplement in the world because, and it's held up to all of the criticism that has come to it. So if you're looking at the research on creatine, we know that there's research that says it's going to improve your muscle mass. It's going to help you recover faster. It's going to help you with strength. You're going to see improvements in terms of preventing muscle loss as you age. Creatine has great studies on all that. One of the things that nobody talked about until recently is the neuroprotective effects that creatine can lend us, which is basically showing that it can help protect our brain cells from injury. So this is like in things like traumatic brain injury, or if you've had a history of concussions or head trauma, creatine is very high on the list of things that we know will help to protect those brain cells and cognitive function as well. So there's studies that show like short-term memory gets improved and active recall gets improved in people taking 5 grams of creatine a day. There was a few studies that showed giving it to people who had neurodegenerative diseases also showed improvement. So you look at all this and you're like, okay, it improves, muscle function on all levels. It can improve strength and it can improve my brain health and my memory and the protection of that. For a cheap supplement that you like pop in a glass of water every morning, maybe with like a little pinch of sea salt and knock that down. I love it. That's my routine. So I wake up, I go right away, grab a glass of water, fill the water up, put a scoop of creatine, put a little bit of like a sea salt or a sea salt supplement, some sort of a hydration electrolyte, and I drink that right away. I think that's a really great way to take this in. You get it in first thing in the morning, go do your routine, go work out. I cannot think of very many people who won't benefit from taking creatine. And so creatine basically replenishes ATP. So it replenishes the energy in your cells. I mean, if you're working out, you need that to happen so you can work out again. It helps them recover and rebuild faster. When it comes to like brain cells and nervous system cells, same thing. The more we replenish that energy, the better they're going to function. Apparently, the more protection and repair they're going to have, and the better the mitochondria will work. So like if laser, going back to that, helps our mitochondria produce more energy from that stimulus of the laser on the mitochondria, creatine is like going inside and an internal laser therapy. So it's going into your cells and helping them produce ATP from a chemical standpoint. So love it. Take it. I think I see a lot of young people taking it. My call out to y'all asking this question is I would like to see my older patients taking creatine. You will absolutely feel a difference. Take 5 grams a day. You're not going to have any negative effects from it. you're going to do great in terms of muscle mass, muscle building. You'll see really good improvements, and a lot of research showing that it's really good for brain health. So yes, it passes the research test for sure. All right. What else we got? Beautiful. Great question. So when we're looking at this, okay, I'm going to get on my soapbox for a second, because this is a really good question and something that we talk a lot about. So is there a difference between injectable and oral BPC 157 peptide for healing? Okay, if you're listening to this and you haven't heard of BPC 157, BPC 157 is a naturally occurring peptide that occurs in your stomach. It goes and initially is used to repair tissue in your body. This has been discovered for many years that if we got it to high enough levels, it would go out and help repair tissue throughout your body. This has continued to grow the body of research, and the utilization in the regenerative therapy world has continued to climb. I'm not going to say this is like a magic peptide, but it can really help a lot with tissue regeneration. We see people with rotator cuff tears, cartilage damage, nerve injuries use BPC 157 to help repair all the way, like to a healthy tissue. I really like this. One of the misconceptions, though, is that the injection of the peptide, even over the area of pain, is going to make it more effective. And that just does not hold up. That's not what happens. When we get BPC 157 in the body, it gets picked up by the bloodstream and it gets distributed to the sites of injury. Whether you inject it right over the shoulder or you're taking this orally, it's going to get delivered in the same manner. So we don't see any difference in recovery between somebody doing an injectable BPC 157 versus an oral BPC 157. For that reason, we use the oral a lot, because injecting yourself regularly is not the funnest thing in the world. My caveat to this is, if people have stomach issues, then I have seen a few of them do better with the injectable, because what BPC does naturally in your body is helps repair the stomach. Well, if you start taking it orally, it makes some sense to me that it's going to work there first. So if you've got some stomach problems, then it would probably start going to work on trying to heal the stomach lining like it naturally does in your body before it would get to the other areas of the body. So I think that's a good thing, right? I mean, if you're not absorbing nutrients and you're not getting all that in, you're going to have a tough time repairing anyway. But it does mean that those people are going to feel some stomach stuff for that first month while their body's going through this repair process. So that's the only caveat that I have in terms of differences, is that if somebody's got really severe like stomach ulcers and stuff, and they're trying to heal their shoulder, they're like, look, I'll come back to the stomach. I don't want to deal with that right now. That person, we might say to look at an injectable first. Everyone else, start with the oral. It works so well, especially if you're currently in a regenerative program. So you're trying to regrow a torn muscle, a torn tendon, any of that stuff. We use this in combination with our treatments for regen, and it does incredibly well. As of right now, Heather, there's really only one company that I think we use to source BPC 157. I've seen not a ton. I've seen probably like 3 or 4 people who kind of got like some of this experimental BPC 157 online that says like for research purposes, and people had bad reactions to it. So we have BPC 157 in the office that is an oral that we trust. So if somebody's looking for that, you can give us a call. We do ship it or anything like that. But it works really well to get into that regenerative process. And actually regrow some tissue. So, give us a call. We have a great relationship, great source with BPC 157, and be careful with some of like the research only products that you can find. That's what I'll say to that one. Yeah, you can call the office. They'll have it. It's a really good thing whenever it comes to regenerative therapy and rebuilding healthy tissue. I saw one of my patients today who we redid an ultrasound on their bicep tendon. They had some tears in the bicep tendon, did BPC 157 and some laser therapy on it. It looks completely normal. Some of the inflammation, swelling, and some of the tears in the bicep tendon have healed completely over about a 90-day period. So it can do some really great things when it comes to tissue regeneration. So beautiful. Wonderful. Thank y'all so much. Usually we try to hit about the 30-minute mark. If anybody has questions, don't forget, you can text us. If you know somebody or you've wanted to get more information about health, about healing, our team set the goal to make sure that we get everyone in the Acadiana area access to healing, information for health and transformation. And so share this with somebody, tag them, whatever. I know some of the men in our area might be a little bit hard-headed. So if you need to reach out and give them a little bit of a push to get the care that they deserve. Sometimes you're like, oh, I don't know how they got your number and called you. No, we're here to help any way we can. And I hope you get some value from some of these things. If y'all have any questions that pop up, you can shoot that text message to 801-691-7582 if you're listening to it. Or just give us a call. A lot of times my office will take down numbers 504-5144, and one of the docs will give you a call and have a conversation about whatever's going on, however we can help. So that's it. That's Tea with Dr. D. I will see y'all in April. So we will do this on April the 30th. April 30th. Mark your calendars, share your friends, tell your mom and them. April 30th at 6 o'clock. We will see you then. Have a great evening, everybody.